Welcome back, and we're moving into our second conversation for today with representatives of the Karl Huesner Memorial Hospital. We have with us on set Tylon Tillett, who is the Public Relations Officer at the KHMH. We have Michelle Hoare, who is the Director of Nursing Services at the KHMH, and we have Norman Augustine, Director of Finance. Good morning and welcome, and thank you for being here.
Good morning, Marlene.
Now,
good morning, Isani.
A few weeks ago, there was an announcement made by the hospital with regards to the renovations and the developments that were to have taken place and how that would have affected some of the services being provided by the facility. Can you guys speak to us in some detail with those changes and what has happened since?
In general, the KHMH is in an ongoing process of renovation in order to better serve the public. So a few weeks ago, we did make an announcement that there would be some infrastructural improvements to our operating theaters. And so we're in the process of renovating, changing out some of the old equipment that we have, not old, but antiquated, some of the equipment that we had. We've been in existence for 21 years, so we're making sure that we're upgrading to better address the public.
The other issue is with our central sterilization unit. We were having some problems with the sterilizers. Those are we're under control with those. We've introduced new control tests for the sterilizers, so we're almost back, to normalcy. The issue now is with our operating theaters. We're actually doing renovation suite by suite. We have a total of 4 operating suites, and in order to not affect totally the surgical services, what we're doing is we're doing renovation 1 suite at a time for the operating room. And of course that slows down the service. For us being a national referral hospital, everything comes to us. So of 3 or 4 operating theaters not, functioning up to the level where it should be, it really does slow down the service, and that will be this way for a little while until we get all the theaters renovated and back on,
To be very clear, you've said that any emergency surgery will be allowed for. It's more the elective ones that are being staggered to.
All
day cases.
All emergency services will be addressed. It's just elective and day cases that will be put off for a period of 1 month. And so I believe it's the first week of March. We should be back to full function.
Okay. Now I want to get to the issue of finance, because that is the most critical for the KHMH. And Norman, you can jump in here. We know you've had a public campaign going about being able to have people do a very simple thing that we have to do everywhere else, which is pay your bill. Sometimes I think there is a confusion that because KHMH is a national referral hospital, people assume that the services are completely free. And it is not the case. There are expenses incurred and the money needs to be retrieved. Let's talk about how things have been going since you started this public awareness, and whether or not people are really grasping the issue that they need to be able to contribute back to the expenses that they incurred at the hospital.
That's an interesting thing that you said, Marlene. Indeed, the mentality and the cultural identity of the KHMH by the general public is that we are a public hospital, and that is not necessarily the case. We do have a KHMH Act by which we have a board of governors that manages and runs the hospital through the CEO and then of course the relevant directorate. KHMH is not here to make a profit. KHMH is not here to be a business entity per se. It is basically requesting of the general public to just contribute a percentage of what it costs to run the hospital. And the campaign, we started aggressively on this a little over 2 years ago. Tylon is very much involved, Ms. Hoare is very much involved, the entire directorate and the KHMH, all the employees, and I must say kudos to the employees, are very much involved in this campaign to educate our public, to educate our patient. I mean, our statistics show that 380,000 people pass through the KHMH on an annual basis as visitors, as sick, as relatives, as what have you. And so we recognize that we are touching a significant part of the population. all we're asking is just contribute a little 20%. It's not much. In some cases, the expenses are higher. In others, it's like non-existent.
Yeah.
So for those that we do bill, we ask that they contribute, and it has been going well, as a matter of fact.
Yeah.
Our revenue within the
I
hospital
was
has
just about
improved
to ask,
significantly.
how has revenue collection been in terms of asking for this 20% contribution when you have operational expenses, you have your budget that you need to be able to fulfill? How does it work in that context?
All right, indeed, it is a good question, because our budget, for example, for this financial year is $40 million. The government contributes its subvention. It has been committed to that, and it has kept to its word in giving its subvention. So it's a small percentage that we're asking the public to pay. The expenses are significant, but we internally recognize that we had to be more efficient. For example, we are changing out our lights piece by piece to LED lights. We are taking off lights that don't need to stay on. We have running toilets. You have to realize this is a huge infrastructure with a little over 600 employees. It's a 24-hour operation that does not stop. So it has to be continual. And our maintenance guys, they stay on top of things. We reduce our electricity, we reduce our telephone costs, we reduce our water bill, we reduce our input into the food production. So we have done our part as well. And then there's the other part where the customers, the patients, their relatives come in, and then they do their payments.
And one of the things that we try to do is remind the public that when you pay the small fee that we ask for, it's just to ensure that we will be open the next time you or your family member needs us. And I mean, it's not, like Mr. Augustine mentioned, it's not for us to make a profit, but it's to ensure that we are there for you. I remind people that when you come to the emergency, you're paying $10 to see the doctor, but one bag of drip at cost is around $25. The average person uses 3 bags of drip in emergency. You understand me? So these are the things that we try to remind the public, and it's hard for us when people have the opinion that, okay, this is free, this is government, we shouldn't pay something. We're just asking you to maintain what is there for you, and we'll continue to be there for you.
Now, did you identify perhaps barriers as to why? We know the mentality was one. People assumed the service was free. I also know that a part of the conversation was that the billing process probably wasn't as efficient as it should have been. In other words, if you don't get a bill, you don't know you owe.
That is correct.
And you don't know what you owe. So has that been rectified to ensure that people are aware that there is money due for the services they received?
Yes, and indeed, the last time I came on this show, we were challenged by our own internal processes and procedures, where there were patients that walk out, and many times more than what I could have counted, that walk out without a bill. And we have improved that significantly, that I feel comfortable in saying at least 95, 97%, every single patient, everybody that touches the services at KHMH walks out with a bill. And I'm comfortable with that one thing. The billing process is in place. In fact, we are developing a new billing software to make it a lot more efficient and effective and timely. And then we follow up with the patients as to when they can pay. We recognize that there are challenges with regards to financial obligation from these patients. So we encourage them to pay up ahead of time. We encourage them to have their relatives or Social Security or the insurance company pay up as the bill becomes due.
Going back to the current renovations that are taking place at the facility, with such a huge infrastructure to manage and run on a day-to-day basis, how often do you guys either set a schedule for renovation in terms of not affecting too much any of the other services being provided? How does that part of it work?
We do that on an annual basis. We have our strategic plan clearly that sets out the vision, where we want to go for the next 3 years in terms of infrastructural improvements. But annually, when we're preparing for our budget, this is when we'll get together and we'll prioritize the different areas of improvement that we need based on issues affecting the services. And so by doing that, we try as much as possible not to create any, unnecessary operational backlogs or flow issues. So, it's an annual thing.
Yeah.
And like I mentioned before, the hospital is 21 years old. Yeah. In 1995, we were serving a population of 195,000 persons. Today, we're serving double that amount. So we're playing catch up basically. There's always something being constructed at the KHMH. And Matron can reflect on this more. Like, for example, we just put up that new neonatal intensive care unit, a first world initiative, but there's always ongoing construction to catch up to the ever-expanding population and their changing needs.
Yeah.
One of our major and top priority was the sterilizer unit that Ms. Hoare spoke about just now. That was a huge investment to bring that up to standard, and repairs it cost around 200,000. Then of course we have our asthma bay that we should be opening within a few weeks.
Yeah.
So thanks to
It's
donation.
being expanded?
Sorry?
It's being expanded?
Yes,
Yeah.
yes, it will be a whole new area that will be set up there thanks to B&E Trust, thanks to Orinco, and of course the KHMH putting its share as well.
Yeah.
In addition to that, our records room, we had to put an expansion onto our building because then we ran out of space. So we needed to ensure that we have more space as the records they continue to building, as Tylon said, from 195 to 390,000.
Yeah, that's actually been one of the things that you have been working towards, building that public-private relationship, getting the private sector to perhaps sponsor specific renovations. What has been the buy-in from the private sector entities that you have approached? Is it very difficult to get them on board to be able to assist you?
We're working on engaging the private sector more. As of 2 weeks ago, Atlantic Insurance adopted one of the rooms on the medical ward, and they made it really nice. There was coverage for it. These organizations are willing, but to some extent we feel like we have to be more engaging and inviting to them to come and invest in the KHMH. These corporate citizens, of course, they want some return. They want, they deserve some recognition for the things that they do, but they have recognized that partnering with the KHMH does bring benefits and show that they're a good social citizen and they're doing their corporate responsibility, right? So we're in the process of engaging them more in the coming year.
And to add to that, BEL has contributed a little over 20,000 to do some major works in the pediatric wing of the hospital, which was very much needed. In addition to that, courts will be offering something. In the past, SMART has done a significant amount of work in the A&E waiting area as well.
Yeah.
And other social groups like Rotary Club of Belize, and I'm going to forget a whole lot of people, but there's a lot of support. Christian organizations have donated. We have a lot of visiting teams that donate equipment and services and specialities that we do not cover at the KHMH. So there's a lot of public support for the KHMH.
Yeah.
BTL as well has provided at very discount rate 8 megs. Is it 8 megs or 8 gigs of internet service for us at very discount rate? So
you have all of this private sector buying, as we would say, but then there's still the image and the perception that the hospital and the services provided by the hospital, when compared to other facilities in the country, are still a few steps behind. How do you offset, or how do you address this misconception?
I have this analogy that I use, right? If 100 people gets an injection at the KHMH, and 99 of those injections are successful, and somebody gets a swollen hand from one, guess which one the public hears about? It's that one that you hear about. And it has been, to some extent, our fault that we do not toot our own horn, understand me? Of course, over the last 2 years, that has changed. If you notice, we are more aggressive with the things that we do. And I dare say, from patient surveys, at least 90% of the people that enter the KHMH and actually use our services have something good to say about it. I hear all the time where people say, Mr. Tillett, you know, I heard so much things about this place, but the service that I got was not true. So most of the time when we hear these detractors in the public saying things, it's people who have never walked through our door. Does things happen at the KHMH? Yes. But we try to adjust them as best as possible, and things happen all over the world, right? In every health facility.
I would also like to add, sorry, Mr. Augustine, that recognizing that we do have performance issues, that we've engaged in a consultancy. Just recently, we're just finalizing the product of that, where we're doing an entire institutional review, looking particularly at the human resource aspect of it, the management of human resources. And this is a very extensive review that will look at performance appraisal, issues, job description, you know, disciplinary issues. So we are trying as much as possible to improve the performance of the workers, right? So in addition to the infrastructural improvement, in addition to the partnership, we ourselves recognize as an institution that there are things that we need to do to improve the performance, and so we're just about to launch that, and that will be something very positive.
I'm so grateful you mentioned that, because that was really the next area I was going into. Whereas there are specific complaints that take place about the service if there's something that goes wrong, and you know, it is fair what you said. People, it's like what the airline industry talks about. You don't talk about how many planes land, you talk about the one that went down.
Right, right.
And it's a human nature issue. But I wanted to get to the fact that not only are there cases when people have gotten the services that they need, it's more the quality of the interaction with the staff that has really been one of the areas people talk about a lot. And there have been quite a number of concerns about the nurses that are in country, particularly those who are non-Belizean.
Right.
And I know that this has been an area that has constantly been scrutinized. What have you done within your own immediate department to be able to get them to understand that whether it's a minor procedure or a major one, this is life and death for each individual person, and a very emotional time. So there is a sensitivity that is needed.
Yeah. Well, we have the hospital is divided into units, and each unit has a manager, right? And so we engage those managers on a monthly basis, really. We have our meeting, we have our strategic activities that we do. We actually do a lot of monitoring and supervision. We have a complaint mechanism that we deal with, you know, as issues come up. You know, we would deal with those. We do a lot of training and development. And clearly, when it's clear that it's an issue where a staff member is not really fitting the bill, then, you know, the disciplinary issues takes effect. But there are systems in place that we engaged in to get these nurses to understand that, you know, it's no longer business as usual at the KHMH. And I think, quite frankly, and I must applaud them, that they're buying into it, they're seeing the importance of it, and knowing that this new improvement, the institutional review component, is, you know, now taking root. Then, you know, I think they are beginning to realize that indeed it's not business as usual anymore.
And one of the messages you've been speaking about is that people should use the formal complaint system instead of simply posting on Facebook or calling in and complaining. The problem cannot be rectified unless you use the formal complaint system.
Right.
One of the things, and from a public relations standpoint, it's important for me to mention this. A lot of times, especially in the age of social media, claims are made against the hospital, but we are not in a position to defend ourselves without breaking client confidentiality. So there is a lot of time where we have to just hunker down and remain resolute, and as Belizeans would say, take the lick, because we know that that is not the case. But if we defend ourselves, we will be breaking that core value of client confidentiality. So we sit and we just remain quiet and let these things.
That's a tricky position to find oneself in, though, where it's difficult for you to be able to come forward with the truth, simply because, as you mentioned, you don't want to break this sacred
it's an ethical
vow,
commitment,
so to speak, between yourself, the providers, and the clients who are accessing your service. But then it exposes you to to being the whipping boy, so to speak.
Definitely.
Because people just randomly say things, some may be unfounded, but you're not in a position to be able to come forward every time to rectify and to correct what is being put out there because of this particular commitment that you're upholding.
And that's
We
why
do not publicly address the issue, but internally there is not one issue that goes unnoticed. And so while we do not put it out there, we're doing something at the institution, the management of the institution. We are dealing with it, and we're ensuring that, you know, there is no repeat of those type of issues.
I remind our staff daily, it's 600 of us, and we need to remain strong. There are going to be times when we are not able to defend ourselves, but we know that we did the best job that we could do. So it's a hard thing, you know, when the public is out there hammering us, but we have to remind our staff, hey, we need to be here tomorrow morning to continue saving lives. We can't be wavered by something, even though we cannot defend ourselves.
You have to understand too, the demographics.
Yeah.
What Ms. Hoare spoke about is a change in culture. That 600 employees are a representation of the different cultural factors within the city and in some extent outside in the country. So what we are putting in place, the institutional review, the consultancy with Mr. Noel Jacobs, is a slow change in culture and something that we had been working on from over 2 years ago. Mind you, some very important stuff that we need to take away from here. As I mentioned earlier, more than 300,000 people pass through that hospital every year. Every year, 12,000 persons are in a bed in that hospital. Every year, 33,000 persons go to emergency. Every year. Why is it that we always get these numbers? We have such huge numbers. The other private initiative cannot speak about those numbers.
Yeah.
So you also have to understand the demographics of the people that we serve. And there are cases where patients have left from the private institution to come to KHMH. Our standard, our capacity, our ability is second to none. And that is why we are investing in our operating theater suites. That is why we are investing in our asthma bay. That is why we have completed our neonatal intensive care unit, a world-class unit.
And I remind the public, we are the highest level of healthcare within the political boundaries of this country. We're the only ones that have ventilators for pediatric cases. So even if your child is born somewhere else and there's a problem, you have to come back to the KHMH. Our service for money, for value, is untouchable. We are not even in competition with the private institution. It's not a competition. So we remind the public, and the same doctors that see you over there works for us.
Yeah.
Understand? So
Yeah.
So let's talk about some of the improvements that people can look forward to. You've spoken about staggering them, and obviously be working on improving infrastructure while continuing your daily work does cause delays. So let's talk about what's in the pipeline.
Well, the operating theater
Which is ongoing.
improvement, that will be a one-shot thing, but it's a phased approach. We have asthma bay, it's evident, it's there. The improvement in the emergency department, our neonatal intensive care area, that's an improvement, and that's something that's, you know, it's tangible, it's there. In the adult ICU is another area of improvement. In the units, specifically the patient care units, the general units, there are gradual improvements. We do bathrooms, we renovate bathrooms, we renovate patient care areas, the rest areas. And so wherever you go in the hospital, there is some area of improvement that's evident. Specialist outpatient clinic, it's right there. There has been some improvement in those areas. And of course, we hope that the public will be able to see the improvement in the attitude of the staff as well, because there are improvements in the attitude of the staff as well.
And private services, that is the middle road between public and the private hospitals. We're trying to offer to that middle class section of people who want better public care, but don't want to pay the arm and leg at the private services. So we're improving that type of service to the public also.
And we have been in discussion with regards to our new physiotherapy area to expand it because a lot of people come and use it. And our area is too small, so we are in discussion for that as well.
That's one of the most active areas in the hospital.
Yes.
Other than at A&E, right?
Yes.
Now, and going back to the payment issue, Norman, we didn't speak about it earlier, but I think it's important to point out, you do work with people for payment plans, understanding the demographics that you're working with, right?
Yes.
So what does one do? If I have received a bill from KHMH, and the most unfortunate thing is when somebody passes and I have an outstanding bill, I have the expenses of burying them, and I also have the expense of what they used at the KHMH. What do I do? Where do I go?
Well, there is a collection unit which has been set up a little over a year ago. It has been something in the works for over 2 years, and we have our in-house collection unit. So it is clearly marked, and generally these individuals go to the different ward to identify your payment system, your payment plan, who will be taking care of your bill for you. Will it be an insurance company? Will it be your employer? Will it be your relatives? Do you have the funds? In some cases, some of the patients have the funds.
Yeah.
In some of the maternity cases, they would put down a significant 50% deposit and what have you, and then before discharge, they pay out.
Yeah.
There are those cases where, given the demographics, they cannot afford to pay. So we make a plan. We work out something with them that after the fact, after a month or so, they can come in and start maybe paying $100 or maybe $50. It depends on what they can afford. And we do follow up with them. But we'd like to take this opportunity to remind people that once you make that commitment, that you keep to it. That's all we're asking.
See it through.
And lastly, in terms of the people who are listening at this point in time, business sectors who said, okay, well, maybe I can do something to contribute. What are some of the areas that you most need this collaborative agreement with the private sector?
The maternity ward needs a serious upgrade, and we're grateful for anything, whether you come in and say, hey, I'll do the whole ward, or you want to do a wall, or you want to purchase a piece of furniture. Any help is help, and we will greatly appreciate it. Both our maternity and pediatric wards. We're also looking for some corporate citizen to adopt our lobby. It's about time we do. So there's many places in the hospital. You tell me what you want to do, and we will make it happen.
We need to add to that, we are in the process of getting the cost estimate to build a ramp, because every so often our elevator gives trouble.
Yeah.
So I mean, you know, that thing is over 20 years old. So we need financing to build a ramp, and I think it's coming up to around 125,000. So anybody can come in and donate to it.
I want to remind the public, we have an ad that is going out today. It says the KHMH has always been there for my family. Whether you like our services or not, everybody in this country has been impacted by the KHMH. Either my auntie, my granny, my cousin, somebody has gotten our service, and we've taken care of them. So we have this ad that is out, and this you see on the screen, one of our campaigns. 2,500 babies are born at this hospital every year. We take care of you. That's our motto.
We'd like to say a shout out to our employees.
Yes.
All right, our 600 plus employees, because without them, there will be no KHMH, there will be no services.
And despite the individual complaints people get, there are many hardworking professionals at the hospital, and very dedicated, leaving their families behind many times to be able to spend the time there and make sure everyone feels better who's under their care. So we appreciate you being here. Of course, we would like to have you back again, even when things aren't always great, to have you back to discuss what's happening at the KHMH. And hopefully people will be able to understand more about why they need to pay their bills at the KHMH, right? Thank you very much.
Thank you, too.
We're going to go ahead and take a break. When we come back, we'll be speaking to representatives of Grace Kennedy Belize on their 35th anniversary in Belize, right? So stay tuned.